Hi, I'm Dr. Abbie Lebowitz. I'm one of the staff neurologists here at the Animal Medical Center. I'm here today to talk to you about a veterinary neurologic exam. A neurologic exam is the most important test we have as veterinary neurologists to help us localize a problem or help determine where your pet is experiencing a problem. We use this exam in combination with your pet's age and history to help prioritize differentials or thoughts of what could be going on with your pet and help determine if we need to do an MRI, and if we do, where we should be looking within your pet's nervous system. A neurologic exam consists of evaluation of the cranial nerves, or the nerves that innervate the muscles of the face, reflexes and checking awareness of paw position in space called conscious proprioception, as well as watching your pet's gait and watching how they interact with the room. Today I'm going to go over some key parts of the exam, but due to time won't be able to go over the complete exam. The first thing we often do at the Animal Medical Center is let a pet just walk around an exam room. We watch how they interact with us, the doctors, as well as the floor and obstacles in the way to help assess their vision, as well as whether or not they're interacting appropriately with the people in the room and their new surroundings. Then we'll often move on to do what's called a cranial nerve exam. To do a cranial nerve exam, we'll evaluate your pet's face. Sorry, Panda. There are several things we'll test, but some of the key things we evaluate is something called Pupillary light response, or a PLR. To do this test, we'll often take a bright light and shine it into your pet's eye and make sure it constricts appropriately, indicating that they're sensing the bright light and responding to it appropriately. We'll also do a fundic exam, which is an evaluation of the back of the eye or the retina, and it allows us to look at the optic nerve, or the nerve that gives vision. We can find evidence of high blood pressure, infections, or high pressure within the brain within this part of the exam. Sorry, Panda. To do this, we shine a bright light and then place a lens in the area. Good girl, Panda. We'll also test something called palpebral, and to do that, we'll just take an object or a finger and touch the corner of the eye and make sure poor Panda is sensing that we're touching the corner of her skin and then appropriately blinking and closing her eye. We'll then turn poor Panda around, sorry girl, and we'll check what's called conscious proprioception. To do that, we'll have her stand square with all feet square and secure on the ground, and then we'll take her paw and have her stand on her knuckles. What should happen is that Panda should instantly sense that we're doing this, and she should instantly correct. For some pets, they'll stand there with their knuckled over, Panda is at this moment, and that'll tell us that there's a problem from innervation of her digits, Panda, all the way to her head. We'll use this information, again, with combination of her age and her history to help decide where the problem is. Before an exam is done, we'll also check reflexes, nociception or pain, and also watch her walk around and assess gait assessment. This information, again, is then combined, and the team of neurologists, we have 3 staff neurologists on staff here, will then come up with a plan to help determine whether or not your pet needs an MRI, and if so, where the location is. Our ultimate goal is to get your pet back to themselves and back to their full functional and best life they can live.